The latest numbers have just come in and they continue to rise. We are seeing a phenomenal rise in cases and the highest percentage of the variants which are being calculated, Omicron coming up as more than 80% in samples collected in Delhi, samples collected in Mumbai, also in Bengaluru. What is this telling us? That India is indeed in middle of a third wave, whether or not our politicians would like to admit it. Experts are now coming out to actually say this. The head of the country's vaccine task force told NDTV exactly this, that we are in middle of a third wave now. Cities like Mumbai, Delhi, Kolkata combined have just about 75% share of the infections, the very highly transmissible COVID-19 variant, which is Omicron as well. We've reported over 1,892 Omicron cases. That's the latest figure that has just come in. Maharashtra leading the chart over there with 568, Delhi with 382. But at least these are the two states which are testing. There are several others which are not. Goa, for example, has about 5 Omicron cases. But would you really believe that? Because the positivity rate in Goa at the moment is 11.11%. So how exactly are we looking at these numbers? Should we keep waiting in to understand and restrict sort of restrictions on ourselves and curb our daily routines waiting for government, or is this something that we need to do straight away? That's something we'll pick up with our doctors now. Joining me on the broadcast is Dr. Manish Manan, HOD Pediatrics, Paras Hospital in Gurugram. We've got Dr. Hari Prasad with us. He's the president of Apollo Group Hospitals. And also with us is Dr. Lakkarwala, advisor to BMC for COVID Jumbo Centers. Dr. Lakkarwala, if I can begin with you. Mumbai figures, Maharashtra figures are worrying, but at least it's one of those states which is extremely transparent about these numbers. We've seen some quick response actually come in. BMC commissioner there saying that in case cases go above 20,000, there will be a lockdown. My question to you, sir, is this. While we admit, at least from top experts in the country, the COVID task force, that this is a third wave, we are in middle of it. Whether or not, like I said, our politicians would like to say it up front, would like to bring in curbs up front about it as well. What about citizens right now who are still awaiting a booster dose? Could you first take us through who, according to you, is the most vulnerable in the population right now? People who need to self-impose restrictions if they want to stay safe.
Good morning, Sonal. Well, we do know that Maharashtra has been the one state which has shown the maximum numbers right from the first, second, third wave right now. It's been most transparent with the numbers, like you said. One thing you need to understand is that whatever we do right now, starting with the booster doses, is not going to protect you during this third wave. The third wave is well and truly here. It will take some time before the booster dose kicks in. So what citizens do need to do, and like you asked me, the vulnerable group are those who are immunocompromised, those probably people who are taking cancer chemotherapy for whatever reasons, who are immunocompromised because of anti-HIV treatment, or for various other reasons, who are much older than 60 years of age. Those
and
people
got their vaccines quite early, yeah.
Yeah, those people who've got diabetes. So kid yourself not that if you've got 2 doses of vaccine, even if you've got infected previously, the Omicron has shown that it can beat all this and still infect you. So the most and important thing to do, irrespective of what the government does, is for people to follow COVID-appropriate behavior. Please do not let your mask down, irrespective of whatever. Treat every person who comes in front of you as a potential person who can infect you. I think that's what we as citizens can do to protect ourselves. The numbers will rise. Omicron has shown that the rise is far, far faster than the Delta variant.
Right. Dr. Lakkarwala, stay on with us. I have a question about hospitalization as well, but let me go around the table once to get everybody's first comments. Dr. Hari Prasad, if I can come to you next and get your view. So what I'm understanding from Dr. Lakkarwala also is that healthcare workers and frontline workers who got their vaccines pretty early, those with comorbidities, those above 60, those with compromised immunity systems, all these people perhaps need to be extra careful as of this moment. Doesn't matter if you've had a natural infection. Don't be in this delusion that that's going to safeguard you. You got to take care of your health yourself right now and ensure that you are not stepping out until absolutely essential.
Yeah, absolutely. That's perfect. And I think it's not only about them taking care of themselves, it's also about the people surrounding them that they're taking care of themselves.
Yeah.
Because what we see now today is that Omicron is causing a lot of asymptomatic disease or disease with minimal symptoms. The problem when it is causing asymptomatic disease is people don't get tested, and if they don't get tested, they move around in the community as normal individuals. And when they move around in the community as normal individuals, the potential of infecting others is extremely high because they're not careful. So it's not just about the highly vulnerable groups taking care of themselves. It's also about the rest of the community taking care of themselves. It's also about the rest of the people around the high vulnerable group who are taking care of themselves, making sure that they're following the universal precautions, making sure that they're getting vaccinated when it's due to them, and making sure that at the slightest pretext, even with the minimal symptoms, they get tested and make sure that they know that they have the infection and also quarantine themselves. That is equally important because it is these asymptomatic or minimally symptomatic patients who do not know that they have infection who are more likely to spread the infection amongst the vulnerable population than the others.
Right. Dr. Manan, if I can come to you next, if you compare the symptoms as of this moment, Dr. Hari Prasad is basically saying at the slightest indication of a symptom, get yourself tested. Have these symptoms also changed since Delta? We knew that loss of taste and smell was one of the key factors that actually got people to think about whether or not it was Delta, whether or not they had COVID. That's, of course, not the case in Omicron. So take us through some of the key symptoms that you're seeing this time around in this third wave.
Thank you. See, firstly, majority of the people will have no symptoms. Like they said, about 80 to 90% people will have no symptoms at all. And of the remaining who have symptoms, the common symptoms which we are seeing and which are being reported also are basically upper respiratory tract infections like cough, running nose, mild soreness in the throat. You are very right. The loss of taste and smell is not there. I would like to bring about, two studies which have been conducted in Cambridge and Hong Kong on hamsters in the lab. So what they have seen is this particular variant, it spares the lungs. So it generally affects only the upper respiratory tract infection. That is probably the reason why, as of now, till date, the cases have been mild and the hospitalization is significantly less. So that's probably one of the reasons. So it appears to be a much milder variant, just like common cold. But important is that 80 to 90% people will have nothing, no symptoms at all.
So upper respiratory tract infections being seen, and it's sparing the lungs is what you're saying as well. So watch out for your cough and cold, especially this time of the year. But you also mentioned that hospitalizations are not taking place. But Dr. Lakadwala, is that the trend in Mumbai? We've actually seen out of the 8,000 cases that came out, around 500, in fact 576, if my memory serves me right, were actually in hospitals. And out of those 570 odd cases, a double digit was actually seen on oxygen support as well.
So Sonal, the first part of your question, that are people getting hospitalized? Yes. The numbers have gone through the roof in the last 1 week or so, only because Mumbai has a large population of people who cannot isolate because they are clustered in slums and stuff like that, and they don't want to infect their parents, their children, people around them, and that's the reason for admission, not the severity of the disease. Second thing is, what we've seen with this Omicron variant is that, yes, number of people requiring oxygen is far less than the Delta variant. Number of people, and like what Dr. Manan said, it probably doesn't infect the lungs, and that's probably the reason why people are not needing oxygen. People are not needing ventilators. So number of ICU admissions, we have plenty of beds. We still have beds even in the jumbo facilities for admitting people, but the numbers have gone through the roof in the last week or so. It's jumped up by more than 100% admissions.
So are you seeing anybody on oxygen support, and who are these people? I remember during Delta, we saw at least 90% of those on oxygen support were diabetics. Most of them were males as well. We had sort of, learned that category on what was actually, and what kind of people were actually taking the maximum hit of this virus.
So compared to the Delta variant, 2-3 changes I've seen. One is that the monoclonal antibodies, if injected in the first 72 hours, as in the Delta variant, is not as effective in the Omicron. It's being seen more in older people, irrespective of whether the fact that they've had 2 doses of Covishield or Covaxin or any other vaccine as well. So we are seeing that there is a very minuscule percentage of people who are requiring oxygen, but that should not be, because the numbers rise, that minuscule percent will still be significant enough to fill up ICU beds. So we should be on the guard.
And these are diabetics, these are people with comorbidity. Who are these people?
Most of them are immunocompromised because of old age, not necessarily diabetic, but a lot of obese people who are getting this more than the general population.
I see. So obese people, you're seeing them in your ICUs, you're seeing immunocompromised people as well, and older people as well. Can I come to Dr. Hari Prasad next? Then, Dr. Prasad, then, it's so hard for us to be sitting over here and asking people to ensure that they are doing their bit when we see our netas not doing their bit, flouting all sort of laws, flouting all sort of curbs day after day. Just this morning we've seen Arvind Kejriwal test positive as well. He's been across 3 states because elections are taking place. As doctors who are watching over this third wave now, we've seen what second wave had in store as well. What would your advice be, recommendations be to our netas and politicians right now who are the first to enforce curbs but to last to follow them?
Well, we know one thing for certain. The tools that we have in hand to prevent this infection are limited. We paid a heavy price during the second wave. And the tools are very simple: masking, social distancing, avoiding crowds, and getting immunized, hand sanitation. Now, irrespective of what the event is, irrespective of the purpose of the event, the tools for prevention remain the same. And irrespective of what the profession of the individual is, what they are following, the tools remain the same. So whether it's the politicians, whether it's the social gathering, whether it's a cultural gathering, whatever may be the gathering, I imagine that we need to make sure that we follow these 5-6 principles to avoid the spread of infection. Otherwise, we are likely to spread, land ourselves in deep trouble. The Omicron virus is supposed to be less infective, more infective, and cause lesser severe form of the disease. Hospitalizations are supposed to be lower. Intensive care admissions are supposed to be lower. But imagine in a population, because it is more contagious, more number of people are going to get infected. Much more number of people are going to get infected than in the second wave. And even if a small percentage of them need hospitalization, our healthcare infrastructure is going to be once more inundated with patients, and we would not be able to support the need of the community. So I think everybody needs to play a part in this, and we need to make sure that we avoid a situation where the healthcare infrastructure gets overwhelmed like it got during the second wave.
Well, cannot agree more, and we can only hope that our leaders are also listening into this, and the Election Commission is also listening into this. These election rallies turning out to be super spreader events as well. These are rallies, and people often don't get this perspective. And so important to remember, whenever a rally is organized, the politicians invite people. It's not just about people gathering. It's an invitation to a gathering, which is going out by politicians in middle of a third wave. This needs to stop. Who will actually do this, we do not know. Last word very quickly, Dr. Manish, if you want to quickly go through that.
So, politicians should lead by example. Very rightly said so. The people should follow. Yes, Omicron is more infective, less severe, but as Dr. Hari Prasad said, if in such a large population, the demography of a country like ours, the spread is rapid, even if a minuscule people require hospitalization, that will be a problem. So, if we follow simple methods like masking, social distancing, and hand washing, I think if everybody does that, we probably won't even need lockdowns. Simple, basic things. You see, in US, there are hardly any lockdowns, but people are following those norms. And very rightly said by Dr. Hari Prasad, the leaders should set an example. On one hand, you go to those rallies, you invite people. On the other hand, you ask people to close down their shops and their livelihoods. But this doesn't match. It has to match, So,
but politicians are shutting sharp in this election season, and that's something that is of a major concern as of this moment. We leave it there for the moment. Thank you all for joining us. Stay safe, stay healthy. We know all of you also got your shots pretty early on and are seeing patients, continue to see patients in this time as well. So thank you for that. We're going to slip into a break. When we return, we continue to look at the top stories at this hour. Stay tuned.